Hello, dear colleagues. How are you today? I hope you are well. Here we are going to explain another question of dermatology. A 3-year-old girl is taken to her doctor due to a rash on the right upper arm. On examination, multiple raised lesions of about 2 mm in diameter are seen. On close inspection, a central dimple is present in the majority of lesions. What is the likely diagnosis? A. Roseola infantum. B. Molluscum contagiosum. C. Kawasaki disease. D. Viral warts. E. Pityriasis rosacea. Okay, here we have a 3-year-old girl is taken to the doctor due to a rash on the right upper arm. We can see multiple raised lesions of about 2 mm in diameter on examination with a central dimple in their lesions. The central dimple is important in these lesions, and the most likely cause is Molluscum contagiosum. Okay, here we are going to explain Molluscum contagiosum. Molluscum contagiosum is a common skin infection caused by Molluscum contagiosum virus or MCV, which is a member of the poxvirus family. Transmission occurs directly by close personal contact or indirectly via fomites like contaminated surfaces such as shower towels and flannels. This is important. Transmission is usually direct. Okay, the majority of cases occur in children, often in children with atopic eczema, with the maximum incidence in preschool children age 1 to 4 years. Okay, as we can see, our patient is a 3-year-old girl. Okay, typically Molluscum contagiosum presents with characteristic pinkish or pearly white papules with a central umbilication, which are up to 5 mm in diameter. Okay, as we can see here, pinkish or pearly white lesions or papules with a central umbilication. Central umbilication is important in lesions of Molluscum contagiosum. Okay, lesions appear in clusters in areas anywhere on the body, as we can see here, the clusters of the lesion, except the palms of the hands and the soles of the feet. If one patient is coming with the lesions like these lesions, but the palm and the feet of the patient is involved, the most likely cause is not Molluscum contagiosum. It's not Molluscum contagiosum, because Molluscum contagiosum does not involve the palms of the hands and the soles of the feet. Okay. In children, lesions are commonly seen on the trunk and in flexures, but anogenital lesions may also occur. In adults, sexual contact may lead to lesions developing on the genitalia, pubis, thighs, and lower abdomen. Rarely, lesions can occur on their oral mucosa and their eyelids. Okay, here we can see different types of Molluscum contagiosum lesions. We can see here clusters. Here we can see a central dimple on the lesion. Here we can see involvement of the eyelid in this child, and here we can see disseminated infection of Molluscum contagiosum virus. Okay, self-care advice. Reassure people that Molluscum contagiosum is a self-limiting condition. Spontaneous resolution usually occurs within 18 months, and explain that lesions are contagious and it is sensible to avoid showering towels, clothing, and baths with uninfected people, example, siblings of the patient. Encourage people not to scratch the lesions. If it's problematic, consider treatment to alleviate their itch. And exclusion from school, gym, or swimming is not necessary. This is important. As we said, the transmission of the virus is direct or by close by close personal contact or indirect way from it, like contaminated surfaces such as shirt towels and flannels, but indirect transmission is very rare. Thus, exclusion from school gym or swimming is not necessary. Treatment is not usually recommended. If lesions are troublesome or considered unsightly, use simple trauma or cryotherapy, depending on the parents' wishes and the child's age. Squeezing with fingernails or piercing or with orange stick lesions may be tried following a bath. Treatment should be limited to a few lesions at one time. Cryotherapy may be used in older children or adults if their healthcare professional is experienced in the procedure. Eczema or inflammation can develop around lesion before resolution, and this is important. Treatment may be required if itching is problematic. We can prescribe an emollient and a mild topical corticosteroid. For a mild topical corticosteroid is important, especially for children. We cannot use strong or moderate topical corticosteroids. We must start treatment in the matter of corticosteroids. We must start treatment with mild corticosteroids, but if there is no any response, we can use a moderate corticosteroids. Okay, the skin looks infected. If the skin looks infected, example, the skin is edematous and crusting, we can prescribe a topical antibiotic, example, fusidic acid 2%. Referral may be necessary in some circumstances. Example, for people who are HIV positive with extensive lesions, urgent referral to an HIV specialist is required. For people with eyelid margin or ocular regions and associated red eye, urgent referral to an ophthalmologist is essential. Adults with genital lesions should be referred to genitourinary medicine for screening for other sexually transmitted infections. Okay, this was a short explanation about the patient coming with the baby which was brought to the doctor because of rashes on the right upper arm, but on examination we noticed that the baby's lesion is due to a Molluscum Contagiosum virus. Thank you for your attention.